Myopia remains the most common disease in the world and is the leading cause of vision impairment. Everyone is familiar with the symptoms of myopia. It is a decrease in distance vision. People with myopia often squint or move closer to the board or television. The word myopia comes from the Greek word meaning to squint. If you notice that your child is moving closer to the television or squinting, this is a reason to see a doctor. What should you do if the doctor says your child has myopia? It is important to understand that unfortunately, this condition tends to progress until the body has finished growing, and most likely, vision will continue to deteriorate. Therefore, the first priority is to ensure that your child has clear vision. This can be done with the help of glasses and contact lenses. And secondly, try to slow down the progression of vision loss. The most effective method in combating progressive myopia is prescribing orthokeratology rigid contact lenses. In our clinic, we work with orthokeratology lenses from Paragon and Lucid. They are very effective, allowing the child to see clearly throughout the day and helping to slow down the progression of vision loss. These lenses are put on before sleep. The child sleeps in them, and in the morning, after taking them off, can see clearly, for example, to read the board at school, and navigate well outdoors, play sports, and not feel at all like they are nearsighted. The indication for prescribing orthokeratology lenses is progressive myopia up to 6 diopters and an age range from 6 to 18 years. In addition, at our clinic, we can offer you hardware-based treatment to stabilize visual functions in cases of progressive myopia, which should be performed at least twice a year. Hardware-based treatment. Unfortunately, it does not lead to improved visual acuity, unlike lenses. That is, a child who has undergone the treatment sees the same or only slightly better than before the treatment. But it does help slow down the decline in vision with myopia. If you want to stop wearing glasses or contact lenses, and over the past year your doctor has said that your myopia has remained the same, the length of your eye hasn't increased, and the anatomy of your eye allows for it, then you can undergo laser correction using one method or another. The doctor chooses the method depending on the anatomical parameters of your eye, and sometimes your preferences. We offer laser correction using the LASIK technique, femto-LASIK, as well as various modifications of LASIK, for example, with a thin flap or LASIK for patients who have a very thin cornea. Your consulting doctor will explain the nuances and specific features of these procedures to you. What should patients do if laser correction is not an option for them? Sometimes that happens too. If a patient wants to get rid of glasses or contact lenses, in some cases we can offer them intraocular lens implantation. This procedure is also performed for patients between the ages of 18 and 40. If the patient is over 40 but also wants to stop wearing glasses, we can offer a procedure called refractive lens exchange. This is because after the age of 40, a condition develops that is commonly known as age-related farsightedness. The correct term for this is presbyopia.